Hi, this is Laura Burnfield, and we're doing resident care procedure number 58, which is feeding a resident. So whenever you go to bring their tray into them, you always need to double check to make sure that you have, you look at your menu card, make sure you have the right patient and the right diet, the right utensils, everything you need for this. Whenever you take it in, hi, Mrs. Smith. We have lunch here.
Okay.
I'm going to put your head up just a little bit higher. Do you need to go to the restroom before we begin?
No thanks.
Okay. Some facilities will provide a warm washcloth to wash their hands, but you might ask them if they would like to wash their hands. Now, when you're feeding someone, you want to preferably be down at their height having a conversation with them. Remember, feeding is a very social thing. So one of the first things you're going to do is offer them a clothing protector. Would you like a clothing protector?
Yeah.
Remove your lids. Open things, season things the way the resident wants it done, and then you want to feed them on the unaffected side of their mouth. Remember, you want to watch residents for things like pocketing, difficulty swallowing, stuff like that. And what you're going to do is tell them what you're going to put into their mouth before you put it into their mouth. You would take about a half of a teaspoonful and place it into their mouth on their unaffected side. And just be sure to encourage them to chew, swallow, stuff like that, whatever it is they need assistance with. Some people may have special devices, whether it is plate guards, weighted silverware, whatever they need to be able to stay as independent as possible is the goal. And offer them frequent sips of fluid while feeding to cleanse the palate. When they are done eating, be sure to remove their clothing protector. There you go. Wash their hands, and if needed, wash their face. Even though you are feeding them, a lot of times people will put their hands to their face as they're eating, so be sure that you wash their hands afterward. Whenever you take this to out to the meal cart, you want to be sure and note the percentage of foods consumed and the amount of fluids consumed. Remember, whenever you're talking about documentation, you would say, 70% of the food was consumed or 50%. Now, what to report? If your resident is diabetic and they have only eaten 25% of their meal, they've only eaten 50% of their meal, you need to report that to the nurse. A diabetic can go low if they have not had enough food. If they're not diabetic and they've only consumed 25% of their meal, then you need to report that to the nurse also, because they will start losing weight. They need to be evaluated. That's it. Thank you very much.